After making sure that the brace is fit correctly, we want to make sure that the patient is also very comfortable and educated on the use of the dial for the brace. First, I want to make sure that there's no tension in the brace, and so I'm going to have the patient push the button and then bend the knee. That'll make sure that there's no tension in the brace at all. Next, I'm going to have the patient squat down to 90 degrees and report their 0 to 10 pain. What is your 0 to 10 pain?
About a 3.
Awesome. Next, I'm going to have the same thing again, but I'm going to have the patient do two full rotations of the dial. We're going to have a marker on the dial to make sure that the patient can track how many rotations we've done. So that's about 1 rotation, and that's 2 full rotations of the dial. Then I'm going to have the patient bend down again, so squat down to 90 degrees, and come back up and report their 0 to 10 pain.
Closer to a 2.
It's important to note that people are affected differently using a tensioning system, so some people may feel the difference, while others may not. Next, I'm going to have the patient do the same thing one more time and turn the brace to max tension. And so we're going to have the patient give the dial 2 more full rotations. And squat down to 90 degrees and report their 0 to 10 pain. What is 0 to 10 pain?
About 1 to 0.
Now that we have the brace at maximum tension, I'm going to have the patient walk around and give a few steps. Know that the brace is at very high tension right now, and so if the tension is affecting the patient's gait, they can push the button on the dial to reduce the tension. That'll relax it to about medium tension. You can walk around again, see if that's more comfortable. And then in order to fully relax the tension in the hinge, you can push the button again and bend the knee like we did at the start. Now the brace is fully relaxed. If rotating the dial provided pain relief, it's important for the patient to familiarize themselves with varying levels of tension to find the amount that works best based on their activity.